Well, the course is Zombie Outbreak, which I think it's kind of a catchy title, and certainly kind of goes with popular culture today, with just zombies in books and movies, television shows like The Walking Dead. The field of public health, the public health response system, is designed to respond to any and all disaster or crisis events, whether it's a man-made event or a natural disaster. So if we had whether a terrorist attack, hurricane, blizzard, heat wave, whatever, they deal with all these types of things. And it makes sense in the CDC, Centers for Disease Control and Prevention, kind of started to capitalize on it that, hey, we could put some information out there using a zombie apocalypse as the backdrop for a disaster event.
So our goal here was to use the scenario as a sudden emergency, but it has the same common elements for response as would responding to a fire or a tornado or a bioterrorism event. It's important for the students to have context. And Dr. Staley, being a real zombie aficionado, has done a great job communicating his vision and his analysis of the zombie culture.
Bringing in zombies, something that's kind of terrifying to most people, thought of somebody that can't stop them, they're dead, or they're undead, and they're trying to eat you, which is probably a fear of a lot of people, that's a really great hook to bring people's attention to, okay, what would you do if that really did happen? And the public health response system plays a critical role in that.
When this emergency first began, radio and television was advising people to stay inside, behind locked doors for safety. Well, that situation has now changed, and we're able to report a definite course of action.
People are going to go to where they think they can get help first, and that's probably the last place you want to go, especially if you could just stay at home. It's called sheltering in place, sheltering home, and have the materials already at hand to be prepared to stay there for a few days if you needed to.
Authorities have told newsmen that murder victims show evidence of having been partially devoured.
But we thought it would be really important to have a student made up to look like a zombie, and another student as a scientist coming in to explain how the zombie came to be, so that there's context for the student and they understand what their risk is, how to mitigate or control that risk, and by having a scientist in the room who could tell them what to do from a science point of view, allow them to start adding that to their response methods.
Using a zombie outbreak as kind of a fun, lighthearted way scenario, even though it would be very serious if it happened, students can learn what are the basic things that they can do on their own to be prepared for dealing with just more everyday, more likely emergencies.
This course is not just for students in the College of Public Health. It's a kind of course that serves a broad base, and it's for anybody on campus who would like to learn what's the best way to protect yourself and your family in an emergency, and have a little fun talking about zombies while we're doing that.
They're coming to get you, Barbara.